Enalapril. Enalapril, sold under the brand name Vasotec among others, is an ACE inhibitor medication used to treat high blood pressure, diabetic kidney disease, and heart failure. For heart failure, it is generally used with a diuretic such as furosemide. It is given by mouth or by injection into a vein. Onset of effects are typically within an hour when taken by mouth and last for up to a day. Common side effects include headache, tiredness, feeling lightheaded with standing, and cough. Serious side effects include angioedema and low blood pressure. Use during pregnancy is believed to result in harm to the baby. It is in the angiotensin-converting enzyme ACE inhibitor family of medications. Enalapril was patented in 1978 and came into medical use in 1984. It is on the World Health Organization's list of essential medicines. In 2018, it was the 135th most commonly prescribed medication in the United States, with more than 5 million prescriptions. As of August 2021, Enalapril is available as a generic medicine in the U.S. Medical uses. Enalapril is used to treat hypertension, symptomatic heart failure, and asymptomatic left ventricular dysfunction. It has been proven to protect the function of the kidneys in hypertension, heart failure, and diabetes, and may be used in the absence of hypertension for its kidney protective effects. It is widely used in chronic kidney failure. Furthermore, enalapril is an emerging treatment for psychogenic polydipsia. A double-blind, placebo-controlled trial showed that when used for this purpose, enalapril led to decreased water consumption determined by urine output and osmolality in 60% of patients. Pregnancy and breastfeeding. Enalapril is pregnancy category D. Some evidence suggests it will cause injury and death to a developing fetus. Patients are advised not to become pregnant while taking enalapril and to notify their doctors immediately if they become pregnant. In pregnancy, enalapril may result in damage to the fetus's kidneys and resulting oligohydramnios, not enough amniotic fluid. Enalapril is secreted in breast milk and is not recommended for use while breastfeeding. Side effects. The most common side effects of enalapril include increased serum creatinine 20%, dizziness 8%, low blood pressure 7%, syncope 2%, and dry cough 2%. The most serious common adverse event is angioedema swelling 0.68%, which often affects the face and lips, endangering the patient's airway. Angioedema can occur at any point during treatment with enalapril, but is most common after the first few doses. Angioedema and fatality therefrom are reportedly higher among Black people. Mechanism of action. Normally, angiotensin I is converted to angiotensin Roman II by an angiotensin-converting enzyme ACE. Angiotensin Roman II constricts blood vessels, increasing blood pressure. Enalaprilat, the active metabolite of enalapril, inhibits ACE. Inhibition of ACE decreases levels of angiotensin Roman II, leading to less vasoconstriction and decreased blood pressure. Pharmacokinetics. Pharmacokinetic data of enalapril. Onset of action, about 1 hour. Peak effect, 4–6 hours. Duration, 12–24 hours. Absorption, till to 60%. Metabolism. Prodrug undergoes biotransformation to enalaprilat. History. Squid developed the first ACE inhibitor, captopril, but it had adverse effects such as a metallic taste which, as it turned out, was due to the sulfhydryl group. Merck and Company developed enalapril as a competing prodrug. 1213 enalaprilat was developed partly to overcome these limitations of captopril. The sulfhydryl moiety was replaced by a carboxylate moiety, but additional modifications were required in its structure-based design to achieve a potency similar to captopril. Enalaprilat, however, had a problem of its own in that it had poor oral availability. This was overcome by the researchers at Merck by the esterification of enalaprilat with ethanol to produce enalapril. 13 Merck introduced enalapril to market in 1981. It became Merck's first billion-dollar selling drug in 1988. 13 The patent expired in 2000, opening the way for generics.